Good evening. Thank you for joining. We'll just wait a couple of minutes. There was a little bit of a technical delay. Can you hear me? Thank you. So I think we will start discussing a few things while others are waiting to join. So one of the points I wanted to discuss was about toddlers. So the approach to toddlers, the behavior of toddlers, because some of my patients had mentioned that we are focusing more on the newborn care, and we should discuss a little bit more about toddlers. A few important points. So we define toddlers as the age group from 1 to 3 years of age, and obviously we also go through a terrible twos phase. That's the most common concern of parents as to how to handle a child who is going through this tantrum phase. We have to understand that the toddlers are going through a very difficult phase. There's lots of changes. Their physical maturity is progressing rapidly. Their ability to do things independently is a new thing for them compared to the early infancy when they are fully dependent on the caregiver or the parents. And obviously, when they are able to do things independently, they need to know their limits, and sometimes they stretch their levels of independence. So this is one of the commonest reasons why tantrums happen, because they are not sure what level of independence they have. So they always try to stretch their limit, and they try to proceed with testing the parents. The other important point that I would like to discuss about toddlers is the diet, and obviously what to give them, what not to give them, how to reduce the risk of picky eating, and how to focus on their learning. So is it important to focus on learning at 1 to 3 years of age, or should we relax and let them learn as they can? Sibling rivalry to some extent when you get a new baby, when you already have a little baby who is 2 to 3 years old, for example, and what vaccination we normally do at this age group, and in terms of concerns of autism and behavioral problems at this age as well. So I intend to discuss all this over the next half an hour or so, and as I mentioned in the message, I will try to break it down into smaller videos which I will be sharing on the channel as well. So first we will look at tantrums. You can review my video on discipline as well, and it's very important that we have a clear approach as to how to deal with the tantrums in the toddlers. One of the main reasons tantrums happen is because the child is not clear what to do in certain situations. It may happen when they are tired, when they have missed their nap and they are forced to go with the parent shopping, for example. It's not uncommon for us to see children having tantrums rolling in the floor in the shopping mall. So they are bored basically, and boredom happens because we don't teach them how to channel their energy, how to engage them. So we should plan our day in such a way that we don't disturb their routine, and we do it at the time when they are most receptive to changes. So if we want to take them out after they are fed, they have had their nap, and they are in a better mood. When it comes to discipline, the rules are the same irrespective of the age, but your approach will be different according to how the child is responding. We should be consistent. So consistency is the key for the child to learn from one measure that you take. So if you do something like this, you would be receiving a behavior like the similar way the next time as well. And the child doesn't differentiate the response of one caregiver from the other. So suppose the father is mild and the mother is strict, the child gets confused. So it's always going to be a problem in terms of your approach if you are not consistent in the way you approach the discipline of the child. So parents as well as the other caregivers should discuss between themselves what is acceptable behavior for that child. There are times when any child will misbehave even if they are best behaved in most situations. So you have to decide how you approach that occasional misbehavior. It's always important that you draw the limits and maintain it. So you can't give in to the tantrum one day and then say, I'm going to be strict today. So the child doesn't realize your mood is different. I've seen parents driving their child around within a compound, standing on their seat or sitting on their lap, but the same child may not realize when you're going on the road that the father is going to get fined by the police. So the rules are enforced the same way for the child. They don't differentiate the situation, and then this type of analysis doesn't come to them till they are 7 or 8 years old. Uh, when you draw lines in the family, you need to deal with how the child should be treated if they don't listen. And that's where the concept of timeout comes in. Timeout has different terms: naughty corner, naughty step, naughty time. So it also applies to older kids when you call it grounding. So you basically make the child aware that they have done something wrong. You are going to ignore them for a period of time, and the time that you allot depends on the age of the child. So the timeout can start as young as 1 to 1.5 years of age, and obviously each year the child gets older, you increase the timeout period by 1 minute. And a naughty step is a good place. If you have a step in your family, you can have a naughty corner in your house. You can even use a child's bed or a playpen. Basically, you need to ignore the child during that time, make them aware that they've done something wrong. You would not respond to the child. Of course, you need to make sure the child is safe and monitor them, but you don't respond to their tantrums. And to some extent, you can allow crying. And when that 1 minute or 2 minutes finishes, you go back to the child and say, do you realize what you did is wrong? And then you can ask them to apologize if they can, or just if they nod or something, you can give them a hug and make up with that. But do it every time this happens consistently, so the timeout has some value. As the child gets older, you start docking them or grounding them. You take off concessions that they have, like pocket money or outings and so on. So timeouts are one way to reinforce that their behavior at that particular time was not acceptable. In terms of interaction with other siblings, you have to be consistent with the approach between the siblings as well. So if you have a different response to a sibling, don't compare the siblings' performances. Each child is different. Suppose the child feels that you're treating them different from other siblings, they may throw more tantrums. So one important factor is to factor in their mood, whether they are fed, whether they have slept, and try not to do things which will involve attention in case they have other engagements. So if they are tired, you may not want to go to the mall with them. You may not want an appointment. Some things we cannot control. And obviously, don't give in to tantrums on a consistent basis, and be consistent in your family as well. So this is in terms of tantrums. Of course, tantrums happen, and luckily most children outgrow the tantrums by the time they reach an age of 4 to 5 years. Most wild tantrums also settle down, so it's a passing phase. Just like in early infancy we say colic is a passing phase, similarly tantrums is a passing phase as well. But one thing I would like to reinforce here is that the start of the discipline, you start disciplining them right from 6 to 7 months of age, when they're aware, when they're sitting up, when they know they're stretching their boundaries. So if you start early on, it's easier. And reducing the screen time helps discipline as well. So screen time is bad in many different aspects, as I have discussed in my video on screen time. So it's very important to avoid screen time, minimize the screen time when they're older, and totally avoid it till they're 18 months of age. So the next problem we will discuss is obviously diet and picky eating. When we move from early infancy or towards a birthday onwards, we need to reduce our milk intake and progress with more healthy diet. Milk intake twice a day should be adequate in most babies. If you are continuing to breastfeed your baby, say till 2 years of age, you still reduce the frequency of breastfeeding. Remember that milk stays in contact with the teeth longer when the baby is sucking, and so it's not good for their evolving dentition as well if they repeatedly keep feeding. So one of the advice we give the parents to improve their dental hygiene is to reduce the frequency both during the day and during the night. During the day, actually, the child who is not on breastfeeds doesn't need any milk feeds. You can give the milk in the morning, then they can have their breakfast, lunch and dinner, maybe one snack in between, followed by milk before they go to sleep. So 2 milk feeds followed by 3 solid meals and 1 snack should be a reasonable pattern for this age. Picky eating as well starts from your feeding practices from early infancy. So you can look at obviously the ways to reduce it when they are managing their eating habits when they are young. Focus on giving them healthy options and on a consistent basis. So don't push them to finish. Go by their growth chart to some extent. Discuss with the pediatrician what their growth level is. And if they are already eating well and they are growing well, don't change it much. The introduction of new foods sometimes leads to conflict. Again, you don't need to force it on them. If they like it, you proceed with it. If they're not keen on it, you take a step back. And I often tell my families that if you have a child eating one form of healthy food, it's a balanced diet, but they refuse another form, there is no need to force that other form on them for some time. There are situations where you can encourage them to eat it, like sharing from a sibling's plate or some form of competing with parents or other members of the family when they're eating. So this encourages them. The same competition response can be used when there is reluctance to brush the teeth. For example, you can get them to brush the teeth along with the siblings, so they are likely to do it better. So these are techniques you can use to encourage them. There are days when the child doesn't want to eat much, especially if they have a cold or they're slightly unwell or they're engaged in very high activity, so they're distracted. So you may not want to force them to eat. Again, don't give substitutes when they don't eat their meal. So don't give milk just because they didn't eat their meal or they didn't eat it adequately. So the question of adequate is defined by us. So it's not easy to define what is adequate for a particular child. As long as they're growing well, some fluctuation in eating is normal. You can review the video I have on picky eating for further tips as well. But most of the tussle happens because there is a discrepancy between what the child needs and what the parent thinks they need. And also the likes and dislikes are stressed too much, and the variety is stressed too much as well. You don't really need variety if the child is eating good food. So don't disturb the pattern too much just because you feel something new has to come in. Avoid sweets and crispy food which are having processed food. Don't give fizzy drinks to children, and juices are not very healthy foods either. So if you can avoid juices as far as possible, it's good. Fiber intake is important because when they don't eat adequate fiber, they get constipated, and this leads to an ongoing cycle of problems. Water intake should be focused on because inadequate water intake can lead to problems like constipation. Urinary tract infections can be increasing as well. Toilet training is a period when there is conflict, and obviously the child should not be forced to toilet train. You engage it, you bring it up in a reasonably slow pattern, and when the child is ready, you proceed with it further. If you have a new sibling, there is a sequence called sibling rivalry, and this can typically happen when you have the older child between 1.5 to 3.5 years or so. As the child gets older than that, they don't feel too much of rivalry, and it's easier to make them understand to engage better in the care of the younger sibling as well. Actually, the 18-month-old or a 2-year-old may not even realize that they have a sibling, and they do lead a fairly independent approach. So involve the child during the pregnancy. Start talking to them about the new baby that is coming, and understand that they may not understand that it's a sibling that's coming. When the baby is there, they may consider the baby as a toy. So be careful how they handle it. At the same time, don't shout at the baby, don't shout at the child. If they do commit some mistake, be gentle, take them away, and try to make them part of the team. So involve them in the care of the baby, bring the nappies, praise them a lot. Praise works wonders, but negative feedback doesn't do good. So shouting, you always stay in control. Again, going back to the question of discipline, you stay in control, you don't shout at the child, and you try to do your best engaging them. Of course, the mother is tired, the father is tired. If the grandparents are there, you're lucky, and so engage them as best as you can, and support them during this period. Vaccination in the 2 to 3 year period, obviously we are coming on to the second stage when you talk about the optional vaccines more during this phase. The first 15 to 18 months we have the government scheduled vaccines, and we have the vaccines at 15 months and the 18-month stage, which are also covered in the government schedule. The optional vaccines we discuss are often hepatitis A vaccine, meningococcal vaccine, and typhoid vaccine, and the seasonal flu vaccine. So be aware that these vaccines are due during this period. After this is completed, the next vaccines usually come when they are around 4 to 6 years of age. So discuss with your pediatrician regarding the pros and cons of taking the optional vaccines. We do recommend them, but which vaccine you take at what age, how many doses, so this will need to be clarified with your individual physician. Last point I want to discuss today is about autism spectrum, and this is a very important concern that many parents have when they have toddlers. It's very important to know that this is a spectrum. So it's something related to the way the brain neurotransmitters control, and it's partly genetic and partly environment related. So if you have a genetic makeup and you have the setting to provoke it, the child may manifest it. Typically, they start manifesting by 1.5 to 3 years. Some babies, you can pick it up even at 1 year to 1.5 years of age. And the older they get, the easier or more definitive the diagnosis is. Because it's a spectrum, there is a range of concerns. So not every child will be severely autistic. There are children who have interaction problems, they have problems with empathy, they may not feel emotions, but the more severe ones have significant language delay. They don't interact, they usually interact with objects more than people. So if a child has delayed speech and during the first year they're not having much eye contact, they're not smiling in response to the family, they're not looking at where the parent is pointing, they're not trying to get the parent's attention to show things which engage them by 1 year or so. If by 15 to 18 months the child doesn't even say one word, it's worrying. If by 20 to 24 months they're not joining two words, it's a concern. If they don't have eye contact, if they don't listen to you consistently, I mean, children can be distracted, they may not listen to you when they are busy playing with something. And if it is consistently the problem, then you have to think of autistic spectrum. You have the MChat, which you can Google it up, and the American Academy endorses it. This is a 20-question questionnaire for infants between 16 months and 30 months. You can fill in the scores, and then based on that, it will give you a feedback as to what the risk is. If the risk comes high, you have to discuss with your pediatrician or even a pediatric neurologist or a child development center on further takes. So the children with autism have less interaction with the person. They don't understand mutual interaction. The language development is delayed as a reason. Excessive screen time often produces a child behaving the same way. So it is quite confusing. And we have concerns. There's one question, I'll just read that. The comment went away. Let me see how to figure it. Okay. From Praveen, but I couldn't read it. So maybe you could post it again. I'm using the phone now because the computer camera wasn't working. So you could pose the question again and then I'll try to respond. But in terms of how to approach a child with suspected autism, the pediatrician basically assesses the questions and concerns you have. And then if they do feel seriously that it could be in the autistic spectrum, they will refer you for a hearing assessment to make sure that's not the reason for the language delay. If the hearing assessment is already normal, you have to go to a child psychologist who can do a more extended tool to assess the child's development as well as the aspects of autism, whether they fulfill or not. And it's a multidisciplinary approach. If the child falls in the autism spectrum, they need additional support. You need to evaluate more with a speech therapist. We do have behavioral therapist and child psychologist working along with the developmental pediatrician. If you intervene early, the outcome is fairly good. So one of the key messages here is that because screen time can provide some confusion with that, and also it has an impact on their future development and learning, be careful with avoiding screen time when they're young. Totally avoid screen time as best as you can till 18 months of age, and beyond that, limit the screen time. Now for the older kids with the online schooling, it becomes difficult to totally limit it, so you minimize it as best as you can. Second point is, if you have a concern, raise it with your pediatrician. Don't delay. There are a few features that may mimic. I told you about the eye contact, I told you about the language delay. There is something called stereotypy, where they like to do the same task repeatedly. The autistic children do not like a change in their routine. So if you don't give their breakfast on time, for example, or you change the type of breakfast, they totally refuse it. Of course, all children do this to some extent. Stacking cars and toys repeatedly in the same pattern can be concerning as well. Lack of empathy, so they don't recognize the pain that others go through. Not showing emotion, not showing keenness to involve others in what they enjoy. Being focused more on objects more than people. So all these, they may not play well with peers, they try to keep aloof and so on. So all these are important factors that make you think about it, and don't delay, because if there is a delay, obviously the management approach can be different. Most of the management is behavioral modification. We change the way we respond to the child, so we understand the child, what the defect is, how to approach the problem, and then it gets better with time. So I think we will stop here. Thank you for watching, and I hope it was useful. If you have any questions, please put it in the comments in the video, and I will reply to that as well. Thank you, and sorry for the technical difficulty.